Health Minister Dr. M. Preenling today responded to allegations of carelessness by health professionals, urging against sensationalizing reports without clarification. She emphasized that an official at every health center will be available to address any concerns or queries before news items are published. This, she added, would help ensure accurate information is disseminated. The cases reported at Umden PHC and Jengjal Subdivisional Hospital were also addressed.
So with regards to the case of Nongpo, very clearly that, as I had already given you the preliminary report and comment from my side, today the doctors will give you a proper report. We will request the DHS, or will you do it?
Teachers can give a summary
Yes.
of this case.
Yes.
Do you want to give a typed report?
No. Yeah.
So this case, it was a case which had was referred from Umden PHC. This case had gone to Umden in the morning time. She had gone in the morning time, and following that, she was kept under observation in Umden PHC for a few hours, which after that, because she was having this mild blood-stained discharge with around 5 weeks pregnancy. So however, because she was not feeling, she wanted to go home, so she requested for a discharge on request, which we say, stating that she has a small child at home, she would like to go back home. So she went away with the husband, and she was discharged on request at around 5:50 p.m. But again, it so happened that on the same day at around 11:50 p.m. she came back with a history of pain abdomen, and the pain was not that severe. She came walking by herself. So the doctors had attended to her in the Umden PHC, and subsequently they told her to go for a proper checkup and referred her to Civil Hospital Nongpo. And when they because we have only one ambulance in for the from the CMSMS scheme we have in Umden PHC. So, and those we keep for those urgent cases. She was not having active bleeding, patient was stable, BP, everything, and not bleeding also, not much. So the staff from there, they rang up because we have tied up vehicles which provide free transport. We have 2 vehicles, tied up vehicles for CMSMS. So the one was not picking up, the other also he replied after maybe after an hour or so. And since he said that it's not an emergency case, he could not go. So however, the patient and the patient's relatives, the husband, they said that they would like to go that day only, and they were willingly, they said they'll take with their own private vehicle, and they took the patient to Nongpo. So once the patient reached Nongpo, she was examined by the doctors on duty, and what they found was that at around 2:55 a.m. And since she was diagnosed as, at this point of time, just as threatened abortion, and so she was sent back to the maternity ward for observation, and there was no active bleeding, the patient was stable. Then the next day, that was the night of the 21st. So the next day, night of 20th, no, the 21st. So the next day, the gynecologist also had examined the patient at around 9 a.m. and found that the patient was stable. He had given treatment and advised complete bed rest. So, the whole time from 9 till around evening time till 4, there was no other further complaints. But at around 4:30, she again complained of pain of abdomen, and so the staff had attended to her. They had contacted the doctor. That time the doctor was busy in the labor room. So they had, she had gone to the labor room and asked him what we'll do. She's complaining of pain. So he said, as soon as I finish this case, I'll be coming. But for the meantime, you give her some medication, because already she's been looked, the gynecologist had seen in the morning, had written the list of advice what to do when she has any of the complications. So following that, that was around 6:45, around 6, after 6, she was again having the urge to attend the toilet. So the husband was accompanying her. They did not inform the nurse. Actually, she was supposed to be bed rest. And ideally, when we say complete bed rest for threatened abortion, even we have to attend when they go for toilet, we have to give her a bedpan. So they did not inform the staff. So the husband, since she said that she wanted to go to the toilet, so he accompanied the wife to the toilet. And it so happened that as soon as she entered the toilet, she expelled spontaneously the baby, which is not a full term, only around 19 weeks as per USG, which was done previously before all these things happened. She had gone to a private hospital, and USG was done maybe 18th, if I'm not mistaken, and it was a 19-week, 5 days old fetus. So she had expelled spontaneously, and normally under normal circumstances, also below 5 months, we cannot, do any we cannot. The baby unlikely only to survive. So it was a dead fetus, spontaneous abortion. Toilet where she had spontaneous abortion, they took her back to the ward, attended to her. Then the doctor also attended and did check evacuation, so that she will not have any further bleeding. And following that, the patient was stable and nothing else, no other occurrences happened.
Well, it's still under inquiry. We have requested our Director of Health Services, MCH, to investigate into this case, to click into all the details. But prima facie, the case is like this. In the month of January, that is January this year, the person in question, had come at a very critical situation to Jengjal Hospital from North Garo Hills district. And when she came, thankfully, the subdivision hospital has very expert gynecologist, pediatrician there, unlike in many other places. They literally did a lot of work to save her life. In fact, the staff of the hospital had gone to the extent of donating blood to arrest her bleeding, and she was already bleeding, and she was to arrest the bleeding and all. They had done all this exercise. 4 months later, on different occasion, this matter had come up, and internally they had dealt between the party and the hospital and some expenses. But still, the matter is under investigation. I want to take all the documentation before we coming to it. But the point here is very important. Jengjal Subdivision Hospital is now very reputed. I request all of you to actually, if you're willing, we will also, kind of come with you, but to arrange a trip. That they have created a lot of changes in that area in terms of, because they have in subdivision, as a subdivision hospital, they have a ICU there. They have a neonatal ICU. They have a PICU. They have an operation theatre. They have a gynecologist. They have a pediatrician, and it provides services to so many of them. And they have really helped a lot for the community that side. Many people, even from very far distances, come. I have myself seen patients, even some of them going from as far as West Kasi Hills to all the way there to take some specialized treatments. So that level has happened. But anyway, with all objectivity, without saying all these things and etc., we are still looking at the case individually and what exactly had happened case to case basis. But prima facie, I would like to remind you all that particular person in question's life was first saved by the same hospital. And after that, etc., and the condition what was found also, we want to ascertain what exactly had happened, because there is some version of hospital and some version of the patient and saying. So give us some time, we'll come into that. But again, in that case also, as a notification was issued from the department, the process of investigation is on. Before that, naming people and putting them, they all have, all the doctors, senior doctors are here. They have very long career, and it is very, very, very close to them, like all of yours and ours also, etc. It's very close to them. So I request all of you to none of you to, in fact, take any names or etc. like that until a proper inquiry is done, and whatever further course of action will be done based on the inquiry report.